Welcome, everyone. Today, for the next hour or so, we are going to cover current year single audit matters and challenges. And we're going to kind of gear it a little bit more towards nonprofits. So if you're a governmental person here, you might still glean some things, but this is mostly going to be geared towards some nonprofit kind of centric ideas. But feel free to ask questions, put it in the Q&A. I'll try and take them as they come. Again, my name's Kurt Schlicker, partner with Eide Bailly, and I'm physically located in Reno, Nevada. So what's on the agenda today? Like I said, the next hour, we're going to do a brief, and I'll call it brief, COVID funding overview. We'll do a little bit of a recap of the federal legislation that's happened in the last couple of years. We're not going to go through it in detail. We will cover some of the highlights, some of the more significant acts, the ones that have more impact on kind of the nonprofit space. Then we'll talk about some current year updates, single audit related matters, as far as, preparing the CFA, data collection form, some of those type of things. And then to finish the webinar off, we'll talk about common single audit deficiencies, and we'll try and approach this for common errors, common findings, just common things we've been seeing over the last couple of years, especially as they relate to COVID, but just in general as well. And that is basically all we'll have time for, and we'll cover it pretty quickly over the next hour. So unless you've been living under a rock, everybody is aware that there has been a lot of federal legislation over the last couple of years. No matter your party affiliation, there has been a ton of federal activity. It started at the beginning of the pandemic. These go in chronological order, date-wise, but it started at the beginning of the pandemic in that early March of 2020 with the Preparedness and Response Supplemental Appropriations Act. That was really just gearing up to start getting some testing, start developing vaccine, really getting healthcare kind of prepared for the pandemic and really at the beginning phases. Then we had the Families First Coronavirus Response Act, and that happened just a couple of weeks later. And that was when people were getting sent home and nobody knew how to treat, PTO and sick leave, and what happens if you have to go home, but you have to take care of somebody who has COVID and you're isolating, and, kind of, if you remember back to that time frame, all of those questions and what happens there. And the federal government wanted to supplement some of that because they didn't want businesses harmed. They didn't want employees harmed. They wanted to try to keep some status quo and to keep everybody safe. So that was one of the primary motivations there. Then really big one that everybody's heard about is the CARES Act. And this was for $2.2 trillion. And this was, really significant legislation. It had a lot of different things on it. We're going to cover it in a little bit more detail on the next slide. But the CARES Act created a lot of those big federal programs that we're all familiar with. Again, we'll talk about it a little bit on the next slide. The Paycheck Protection Program and Healthcare Enhancement Act. PPP had already been around, but here's where they got more funding for PPP. It got extended. That's pretty much the major program there. Then we had the Consolidated Appropriation Act, or CRSA. And for those of you that remember, there was kind of two things going on at this point in time. They were threatening a government shutdown, right? They didn't have a budget passed. And quite a few of the grants, particularly the Coronavirus Relief Fund in the CARES Act, had an impending kind of period of performance deadline of December 30th of 20. And so the feds decided, well, let's kind of take care of both at the same time. And they passed the Consolidated Appropriations Act in December of 20. And as a part of that consolidated appropriations, which was a bunch of, budget appropriations, they also had the CURSA embedded in that, and the CURSA is what extended, for example, the Coronavirus Relief Fund period of performance an extra year, and did some other supplemental stuff. Again, we'll talk about it some in a couple slides. Then we had the American Rescue Plan Act, or ARPA, or ARP, depending on where you're at in the country and how you've heard it referred to. 1.9 trillion. And again, this one is what we're seeing a lot of now. So CARES Act is, mostly spent as far as everybody's concerned. That's winding down. There are a couple programs hanging on, but winding down. And ARPA is kind of the natural extension of CARES Act. We'll cover this a little bit. There's, a lot of programs in ARPA as well. And then one that we won't really cover at all today is the Infrastructure Investment and Jobs Act. And that was 1.2 trillion in spending, and they apportioned an extra 550 billion in new monies. The idea with this one, again, we're going to focus more on the nonprofit side, and this is mostly government related, but just for your information, the idea with this one is, hey, let's start investing in a lot of infrastructure, very similar to the New Deal when the economy was poor during the Great Depression, and we did the Hoover Dam and all those big federal infrastructure projects. Let's keep the economy going by spending a lot of money in infrastructure. It keeps people working, and it's more of a 4 or 5 year plan on the Infrastructure Investment and Jobs Act. Again, the idea is keeping people employed, working, spending, big construction projects. Okay, so the CARES Act. As I said, this was in March 27th of 2020. The overarching principles and goals of CARES Act was to keep workers paid, healthcare and system enhancements, economic stabilization, right? Really, there was a lot of fear at this time. Everybody was going home. So you got to remember that motivation. And they created emergency appropriations for basically all US federal agencies. But the 3 main programs were the Coronavirus Relief Fund, the Education Stabilization Fund, and the Provider Relief Fund. Now, CRF primarily went to governments first, but I'm imagining that a lot of you on this call, if you're, a nonprofit entity, applied for or received some sort of either grant under CRF or subsidy. And there were a lot of beneficiary subsidy type programs out of CRF. A little bit later in our slides, we'll talk about the difference between a beneficiary or a subrecipient, but there was a lot of activity to help nonprofits. Many jurisdictions across the country implemented subsidy programs because nonprofits couldn't fundraise anymore. If you can't have your big gala or your big fundraising event, that was a significant amount of cash flow for a lot of nonprofits, and many jurisdictions implemented some sort of subsidy program to try to keep nonprofits whole for that, lost fundraising money, as an example. Obviously grants and other public programs were incurred as well. The stabilization fund, that's all education related for obvious reasons. There was a K through 12 and a higher ed, kind of different tranches for the education stabilization fund. If you're nonprofit higher ed, you probably got some HERF, which is the higher education tranche of education stabilization. Lots of rules, lots of spending on that. We're not going to go into big details on this because it's mostly historical information at this point, should be mostly spent, but I'm just trying to give the high level overview. Provider Relief Fund, that went to Medicaid, Medicare providers, could be commercial systems, could be governmental systems, could be nonprofit systems. If you build Medicare, you would get provider relief funds. Anybody who's been through that has known that it's been quite a journey for the PRF folks as far as administering the awards and grant compliance and all of that. Okay, so then fast forward to December 27th, which was 3 days prior to the expiration of the period of performance for the CRF. And if you received CRF awards from your state, city, or county, you probably remember this and may or may not have been confused, but they passed this with 3 days to go, and they extended the period of performance for CRF. They again added more funding to the Education Stabilization Fund. They really bolstered funding for transit because public transit at this point in time was in shambles, and they created the Emergency Rental Assistance Program. So some of that, again, may be applicable to you all in this room. One that was a significant piece out of the Consolidated Appropriations Act, other than CRSA, was also this Economic Aid to Hard-Hit Small Businesses, Nonprofit, and Venues Act. And that created the Shuttered Venue Operators Grant. And so if you were any sort of entity that gave live performances or had live exhibitions, like a museum or a theater company, something along those lines, you could qualify for SVOG and receive some assistance. Again, the feds were trying to keep people or keep businesses and individuals, but keep businesses at some sort of baseline equality to what they were pre-pandemic. And that was really the overarching goal between CARES Act and the Consolidated Appropriations Act, was to keep businesses equal to pre-pandemic levels. Then we had the American Rescue Plan Act, and this was, seen as, hey, CARES Act, Consolidated Appropriations isn't going to be enough. The pandemic had been lasting, longer than everybody hoped. It had lasted through the winter. It's into 21. We need another bridge gap for that. And the feds passed ARPA, and it pretty much was just continued support to all the federal agencies, to individuals, to businesses. They got rid of CRF, and they, coined it the State and Local Fiscal Recovery Fund. That is almost all government centric. The only place where nonprofits will see the local fiscal recovery funds is if you're receiving some sort of subsidy or subgrant from your city, county, state. But there's a lot of money in that. And we are seeing across the country, a lot of subsidy programs. So be aware, reach out to your state, ask them, hey, are nonprofits at all included in your spending plan for your fiscal recovery funds? Inquire what type of programs and assistance they have. There is a lot of money that was sent to states for the fiscal recovery funds, and they're thinking up their spending plans as we speak. They're trying to spend the money. And so I would encourage all of you listening to reach out to your state, if you haven't already, to ask what type of assistance is out there. They expanded and extended the Emergency Rental Assistance Program, again, to help both renters and landlords, because you couldn't, for a time there, you couldn't evict anybody, but if your tenant couldn't pay your rent, the landlord was being harmed in that situation as well. So they were trying to make landlords whole and give that rental relief also to the tenant. So it was kind of a two-pronged approach. More funding for SVOG, and again, across the broad spectrum of all the US federal agencies. Okay, so that, I told you, would be a very brief overview of the COVID funding. It's been over 8 trillion in new monies in the last 2.5 years in legislation. If it seems like things have been changing fast and furious, they have. It seems like there's been a lot of new grants and just a ton of activity. It's because there has been. And so again, if you have any questions, and I know I went super high level on the COVID funding just because I didn't want to bore people, but if you have any questions, please chat them in the Q&A and I'd be happy to talk about them. Okay, so now if we're talking about the single audit and how all of this impacts the single audit, and especially from the perspective of your nonprofit and you received a sub-grant from your state or your county or your city, and well, with all of this new spending, there's a lot of money available for all these great programs, but now you have to have a single audit and you've never had one before. What are some things to watch out for, things to be aware of? And that's really what we're going to focus the next 30 to 40 minutes on. You are required, when you are preparing a CEFA, and the CEFA stands for Schedule of Expenditures of Federal Awards. Okay, that's your schedule that you list and you put all of your federal grants on it. You are required to identify what funding you received that was part of any of these federal acts, basically everything except for the Infrastructure Act, because that's not COVID related. That's indirectly tied to COVID as far as future economic stimulus by increasing the number of construction jobs going on, but that's not in direct response to the pandemic per se. It's more indirect. So if you received any grants under Families First or CARES Act or CURSA or SVOG, under the economic aid to hard hit businesses, the American Rescue Plan, if you received any grants under COVID-19 funding, you're required to put COVID-19 as an identifier on your Schedule of Expenditures of Federal Awards. Okay, so that's not too bad. It's pretty simple. Not only do you have to define the COVID funding on your Schedule of Expenditure of Federal Awards, but also in your data collection form. And if you've never had a single audit before, the data collection form is basically the summary of your audit results and your audit that is put into kind of it's put into an Excel, and then it's uploaded to the Federal Audit Clearinghouse, and that's where it becomes kind of public information, public document. It's also where the feds can query, the results of the audit by running, did you have any findings? What were your programs that were audited, etc. But you also have to identify any COVID funding as part of that data collection form. And, if Eide Bailey's your auditor, don't worry, we will assist and help and point that out. We prepare the data collection form as a non-attest service for auditees a lot of the time. You'll see that and it'll come up. Okay, what are some other challenges related to the CEFA? Well, as I went through all of those federal acts and legislations, you will notice that there was a lot of extensions. There was a lot of, ERA 1, ERA 2. There was, additional funding for education stabilization, and PRF had a lot of different things. Well, it created, in general, a lot of confusion of what was allowable, what wasn't allowable, and when can you charge things. And, if you determined something was allowable in, September, and they were costs in April, how do you treat that on the CEFA? There's specific rules, and each program kind of is its own little nuance. PRF has very specific rules on how to report on the CEFA. Some of the other federal programs do as well. if you have questions on the timing, meaning you're trying to claim expenses from your previous year, reach out to your auditor. And if it's Eide Bailly, reach out to whoever your Eide Bailly representative is and ask. It's much better to be kind of upfront and try to tackle this at the beginning than for it to come up during the audit process. And sometimes you might not just know how to do it, and it's okay to ask. So I would strongly encourage all of you that if you have any sort of weird period things with when you're requesting funds, what expenses you're getting reimbursed, to ask. There were also a lot of award amendments, and from a nonprofit perspective, a lot of times you might not even be receiving awards from the state. You might have gotten some sort of email or notice that said, hey, we're going to give you this money. You taking the money is acceptance of the terms and conditions of this money. And then you get some sort of link to some sort of generic, CRF thing, terms and conditions that make no sense to you because they're, terms and conditions that the state had to abide by with the feds. And you're reading this going, well, what am I supposed to do? The state just gave me $500,000. What am I supposed to do? So that is a huge challenge. And, unfortunately, it's not supposed to go that way. But we've got to also remember that states, counties, cities, they were given a very short amount of time to try and spend money. And this was all done during the pandemic when they were just trying to get it out there, trying to help the people, trying to help businesses in need. There was a huge amount of political pressure, and it just didn't go through the normal, chain of command. It didn't go through the normal processes. Many states didn't issue subawards. And so trying to figure out what program it is, what's subject to audit, all of that, again, big challenges, and just reach out to your auditor, ask the questions. I've never heard of anybody in Eide Bailly that was upset with a client contacting them and asking them a question of whether or not this, new significant money you received is subject to audit or not. Never heard of that one time. One small note for nonprofits: if any of you, for your bedtime reading, like to read the compliance supplement, which I would be very impressed if any of you do. But there is a compliance supplement available for the local fiscal recovery funds. And they provide for, it's not an audit, but they provide for an audit that is not a single audit. And they call it an examination engagement. But that is not applicable for nonprofits. Nonprofits do not qualify for it. You will never qualify for that. And so if you're looking at it or reading it and saying, hey, can we get anything other than a single audit? Can we do this examination option thing that I've heard about that, some of my colleagues in the industry have talked about? The answer is no for fiscal recovery funds. Because the only way you would receive fiscal recovery funds is through a subgrant, through the state, county, city, whomever. And if they gave you the subgrant, then you automatically don't meet the criteria of receiving money directly from the Treasury or pass through the state as a non-entitlement unit, which is a small government. And so since you don't meet either one of those criteria, you would automatically not qualify. So if you got fiscal recovery funds, if you are determined to be a subrecipient, then it was subject to single audit. If you're deemed to be a beneficiary, then it's not, then it's just revenue. So some of you may be asking, what is this concept of subrecipient versus beneficiary. And, we could spend, I don't know, an hour talking about different examples on what a subrecipient or beneficiary is. But at a high level, if you are receiving money as a nonprofit, as a subsidy, meaning the government is giving you this money to help you, the business, to replace revenue, to pay for utilities or rent, or help offset some of the cost of inflation, or whatever it is. If you're applying as a nonprofit to get aid as a business, then you would generally be a beneficiary. Very, very common across the country, where a lot of jurisdictions, again, ran subsidy programs for lost fundraising revenue. Okay, that is a classic example of being a beneficiary, because you're not carrying out some sort of program. You're not trying to carry out the public good with respect to these monies. The nonprofit, you all have your nonprofit missions, but you're not taking that money to carry out, some sort of HHS or education or mental health or whatever type of program. You're taking that, to replace your lost fundraising revenue, essentially, so that you can keep your cash flow and make payroll. That's very different than a subrecipient, where they give you a sub grant and they say, hey, we want you to run a mental health program for us, or we want you to help run some access to healthcare program, or whatever it is. And they give you grant monies, which are, payroll reimbursement and maybe some end user beneficiaries, because you're not the beneficiary. Whoever that potential patient is, or that potential client is that you're referring to the doctor, is the end beneficiary, right? You're not the beneficiary. There's another tier of user after you. Then that is more of a subrecipient relationship. So, got a question in the chat. If the amount of funds are reported on usaspending.gov under the tab which has subawards, does that mean you are automatically a subrecipient? So USA Spending is a place where the state or first tier recipients, direct recipients from the feds, that's where they report their Transparency Act reporting. And they're required to report on all of their first tier subrecipients. So I'll say it this way. Technically, if they reported your grant under that tab, they are probably thinking of you as a subrecipient. However, that does not mean that they might not have reported that in error or changed their minds, or the person who was reporting it under the Transparency Act reporting wasn't talking to the person who was writing the agreement and the scope of work and carrying out the program. Those aren't always the same person. And so I would say, they report their subrecipients there, but that I wouldn't use as the only piece of information to make the determination of whether you were a subrecipient or a beneficiary. If it's not clear in the agreement, then I would call the state or county or city or whomever gave it to you. If you have no agreement, then I would still call whoever gave it to you. And if the agreement is the kitchen sink, and I've seen a lot of this too, where right, wrong, or indifferent, the people, the pass-through entity was like, well, we don't know whether you're going to be a contractor, a beneficiary, or a subrecipient. We're not quite sure. So let's just put all the terms and conditions in there. And you read this agreement and they've got, all this vendor references, they've got beneficiary references, they've got subrecipient references, and you don't know. Again, call the grantor, pass-through entity, or email them and try to get an understanding. If they are non-responsive or not helpful or don't know the answer, which does happen, unfortunately, then you have to use your judgment. Technically, the pass-through entity is required to make the determination. So it should never really be your judgment as a subrecipient. It's up to the pass-through entity to make the determination. So I guess the only time when you would use your judgment is when they're completely non-responsive and you just have to make a call. But other than that, you should be able to get some information from them. Okay. One note on the bottom here, I did include a vendor determination. Sometimes you're not a beneficiary because you're not receiving a subsidy. You're not a subrecipient, but you can also be a vendor. There's a third classification, and that is when the other entity is purchasing a good or service from you. So if they're purchasing a good or service, then you would be a vendor in that, sense, and your revenue would be some sort of charge for that service or charge for that good. Again, you're not required to make this determination on any of these. The pass-through entity is responsible for that, but sometimes things get missed. There was a lot of pressure on people to get this money out, and again, it's just not as clean as maybe we would have historically seen. Okay, due dates. There are no extensions anymore. The feds, the last extension was for June 30th of 2021 year ends. And that extension just lapsed last month on September 30th. So if you are a year end, well, basically any year end now, you'd be late. But if you're past June 30th of 2021, your single audits are due how they've historically been due, which is in the 9 months of your fiscal year end. So if you're a June 30th, 2022 year end, your single audit is due at the end of March. Okay, so it's back to a normal cycle there. No more extensions on the due dates. There is a new identifier. Some of you, if you've had the single audit before, maybe have been familiar with a DUNS number. And what you used to do is you used to go to a third-party website, you'd apply for DUNS, you'd get the DUNS, and that's what you would report to the feds, sort of like an entity identifier. The problem was it wasn't, you could get multiple DUNS numbers, right? And so in some of the larger entities, you may have 100 different DUNS numbers because you could have 100 different, representatives of your entity applying for a DUNS number through this third-party website. And so you would just get this exhaustive list of DUNS numbers. The Fed said, yeah, enough of that. We really want something that's just a unique number that everybody uses, and it's just one number. And so they, on April 4th, switched that and said, okay, you will now have a UEI, which is unique entity identification. And it doesn't go through a third-party website anymore. It's directly in SAM.gov. SAM.gov is kind of, the new grant depository for federal assistance listings and contract opportunities. Also has the suspension and debarment list in it. So it's quite a robust database now. And that's where you register if you want to do business with the federal government. So if you do business with the feds, you will create a sam.gov UEI. Technically, it's not required to do business with like a county or a state, right? So if you're applying for a grant with the county or state, you're not a federal contractor. However, most states, counties, cities are asking their grant applicants to be registered. And that, again, is just so you're in this tracking database. Again, that's where the excluded party list system is. So, any suspension or debarment stuff. And so it's an easy way for pass-through entities to ensure, an entity is registered and get some information on them. So if, the state's going to require it, even though the feds aren't requiring it, that's up to the state's prerogative if they want all their grant application or applicants to be registered in sam.gov. Much more common now than we saw in the past with a DUNS number. Okay. So now that leads us to common deficiencies, and what have we been seeing in the single audits, and maybe I'll try and give some helpful tips and hints on how to prevent some of the findings. I would say in general, overall, we're seeing some similar themes. And around internal controls, we're definitely seeing a lack of documented review. Why are we seeing that? Well, a lot of you now are either hybrid or remote. You might not be full in person. If you are, great. But a lot of businesses are employing some sort of hybrid model. Some are employing a full remote model. And, pre-pandemic, when everybody was in person in the office, it was very easy to add a signature to an invoice or an initial on an invoice saying that it was reviewed. Please code it here. Same thing with reports. Very easy to document, tick mark reports that you had to submit. Well, with hybrid, with remote, some of that's gone away, and sometimes you don't have any evidence of that review. An email sometimes can help, like, hey, we sent it to such YZ person, but again, auditors want to see something documented. We are seeing the lack of an effective review, meaning, yeah, there might be some sort of email chain that says reviewed, thank you, but that review is very cursory. It's not picking up errors. An initial, an acknowledgement of it being reviewed, that's all fine and dandy. But if the review is not actually doing anything, then it's not effective. No internal control policies. This one is really big, especially in the nonprofit space where you've never had a single audit before. And, you had internal controls maybe for, processing checks, but maybe you don't have a procurement internal control policy for federal procurement. Very, very common. We've been seeing that a lot. What are some prevention tools? Obviously, start working on your documented policies. Hopefully you've been working on them already over the last year or two, but if you haven't, start working on those right away. And that is something, we've assisted with quite a bit, is looking at policies, giving them a once over, saying, yeah, that looks pretty good. We do have some independence lines there that we can't completely cross. We can't write your policies for you, but we can certainly take a look at them and point out any weaknesses that we see. Also understanding the compliance requirements, especially with all these grants, with the terms and conditions. Sometimes you weren't even getting grants. I spoke to that earlier. Really trying to gain an understanding of the program and picking up the phone and calling or emailing, talking to the people who are giving you the money. Is very, very key. I can't tell you how many times, and not just externally with clients, but internally with our own staff as well, where everybody's confused and all it takes is a simple phone call. And for whatever reason, people are so hesitant to pick up the phone. And sometimes you can just schedule that meeting, have that phone call, and that something that you were agonizing over for days gets solved in 15 minutes. So again, understand those compliance requirements. We did have a question in the chat. What about documentation through electronic time review systems? How are auditors looking at electronic approvals? So as long as there is a documented segregation of duties, and we can see that in the workflow of the electronic system, that's fine. That's very common. We see it a lot where employee A submits their time for the week, and then you can see in the workflow that that time must be approved by a supervisor. And once the supervisor approves it, it goes on to processing. That's perfectly fine, as long as we can see where that supervisor is required to authorize it. That's fine. We generally would check to make sure that the employee can't approve their own time. Right? That's the rub that we want to make sure, is that the employee can't submit their own time and approve their own time. Now, does that get a little bit trickier for the person at the top, the CFO? Yes, but we take those on a case-by-case basis based on the size of the entity, how many employees you have, do you have sound internal controls that make sense for your operating environment? And so it's not the same answer for everyone. Allowable activities and allowable costs. Okay, there's a couple of, there's really three, so two are on this slide, and the next one will cover the other one. But there's three basic types of costs. There is services and supplies, there's payroll, and then there's indirect costs. So when we're talking about services and supplies, there are sometimes some very specific exclusions, okay? And those are listed in the terms and conditions of the grant award or the regulations. For example, under the Fiscal Recovery Fund, payments cannot be made to pre-fund a pension plan. Okay, and I know that's not super applicable to a nonprofit, but that's an example of a specific exclusion. And as we just talked about, lack of understanding the compliance requirements, real struggle with subgrants, what's going on. Sometimes some of those specific exclusion items are being missed just because you might not know. For payroll, this one is a big one. There is required time and effort tracking because payroll has to be spent based on the actual time spent. So it can't be based on budget. And that happens a lot. I see it in nonprofit and government alike, where you've submitted a grant application and that's going to pay for 1.5 FTEs. And you're paying for this one full person as their full-time job, and then a half a FTE of somebody else. And you just charge their payroll at that half FTE, regardless of how much time they actually say they spent on the grant on their time card. That is not allowed. You need to track their actual time spent on their time card and charge for the grant based on that. Okay. I'm not going to go over all the cost principles because there's a lot, but you can go to 2 CFR 200.430 and 431 for the compensation related standards. Subpart E has all the general cost principles. Those of you that are wondering what the heck that is, if you go to Google and you type 2 CFR 200, that's Title 2, Part 200, and that is where uniform guidance is. It's separated into a bunch of subparts. You can look at the electronic code of federal regulations and then read to your heart's content. I promise it is great bedtime reading. Okay, indirect costs. This became a challenge because of double dipping. So some of you are probably familiar with PPP, maybe even qualified for the Paycheck Protection Program, ERC, which was the Employee Retention Credit, right? So if you qualified for a couple of those programs and utilized their benefits, you were getting either payroll or taxes, certain costs paid for. Unfortunately, a lot of entities were not going back and looking at what their indirect costs were, right? Because if we think about it, you have some sort of indirect cost pool that you then either allocate out to grants or you divide by total direct costs and apply some sort of ratio. There's a lot of different methods. Again, not going to cover it in too big a detail. But if you had some of those indirect costs that were already reimbursed through PPP or ERC, you needed to pull them out of that indirect cost pool. Otherwise, they are being paid for twice by the feds. This is very complicated. It's very difficult. If you received PPP or ERC and you have indirect costs charged to your program, that's anything other than you get a 10% de minimis. If it's, some sort of other negotiated indirect costs, please talk to your auditor, please talk to your pass-through entity, because it gets very complicated very quickly. Another question in the chat. For time and effort tracking, can I comment on any mitigating controls that might be sufficient as a substitute for time and effort tracking? First year clients often balk at the idea of rolling out time and tracking for all employees when it is not done previously. So the compensation cost principle standards really just require that whatever records you're using be incorporated into official records. And it does not necessarily need to be, some sort of automated system that is doing it. It can be a subsidiary record where they're keeping it in track on an Excel that is reviewed and approved, right? I mean, it can't just be, oh, I wrote my time down on a napkin, here you go. No, there's got to be some other record that's reviewed and approved. But if they don't want to spend the money for a fancy timekeeping system or one that allocates it out, they are allowed to keep subsidiary records, again, as long as there's controls over it, and incorporate it into the official records. And maybe, for the 3 employees that are charged the grant versus the other 50 that aren't, or the other 5 that aren't, more likely, they can do that. Again, the standards for compensation just say you need to be able to estimate actual time spent, and they have to be incorporated into the official records. They can't, exceed the total amount compensated. There's other nuanced stuff, but in general, as long as it's considered an official record, they're okay. Okay. Cash management. This is a really big one. I have had a couple of nonprofits that always had a hard time meeting payroll. And so they would need to pre-bill the grant for the upcoming payroll, because, hey, you've got a $200,000 payroll that's going to hit the bank on Friday. You don't necessarily have 200 grand in the bank. You need the state to come through and give you that 200 grand. That 200 grand needs to hit the bank prior to that Friday, so that you don't bounce checks. There are different allowable methods, whether it's immediate cash needs or reimbursement basis. Ensure you know what is allowed under the terms and conditions. Generally, the state, county, whomever will communicate that. The feds, if they're silent to it, allow immediate cash needs. Immediate cash needs is an advance on expenses, generally about 10 days. I've seen up to a month, but generally it's about 10 days for immediate cash needs. If the feds are silent to it, can be can be reimbursed that way or paid for that way. Again, make sure you understand how the grant is funded. Procurement, suspension, and debarment. I could spend 3 hours on this topic alone. We will cover it in 2 minutes. The requirements. You must have a procurement policy. Okay, you have to have one. That procurement policy, if any state law is imposed on you as a nonprofit, you have to incorporate that. I haven't seen that very often, if at all. So if there is no state law imposed on you, then you just have to worry about the federal law. If you have state law, you have to combine the two. Okay, it has to be compliant with both, if applicable, but at a bare minimum, the feds. And basically what they say is you have to get quotes for small acquisitions, which currently is above $10,000. And you have to get go out for formal bidding if it's above the small acquisition threshold or simplified acquisition threshold, which is currently $250,000. Your organization can set lower policy amounts if they so choose, but that is the federal limits right now. If your state laws are different, pick whatever's the more conservative. So if your state law requires bidding at 100,000, then that's what your policy needs to be. There are 4 different non-competitive purchases that are allowable. One is sole source. This one is probably the one that's most abused, meaning not everything is sole source. A lot of people think some purchases are sole source when they're really not. So please use sound judgment there. It's some sort of emergency purchase where public exigency or harm is about to occur. So you need to purchase something quickly. That's, an excuse not to go out to bid. Hey, we're about to be flooded and we need to go buy sandbags. Well, don't wait for, quotes to go buy sandbags, go get them. You can get prior written approval from your pass-through entity to proceed with a non-competitive purchase. Has to be written though, and it has to be before you do it, can't be after the fact. Or you went out to bid and you only had one response. If you go out to bid and you only have one response, well, you pick that one person. So what do we see? Lack of policies, that's number one. Especially with all the new single audits. Like I said, a procurement policy is not necessarily first and foremost, or you have a purchasing policy, but it's just not compliant with the federal regulations because you've never needed to be compliant. So that's number one. Maintaining quotes is a big one. We get a lot of verbal quotes. You might look on Amazon for 3 different prices, and it's just lack of documentation. It's not necessarily that you didn't get the quotes, it's lack of documenting that. That's key. Lack of competitive bidding. Normally people have records on competitive bidding because it's a big formal process and you keep all of that. But if you didn't go out to competitive bid and you said it's a sole source when it's really not, that's where entities tend to get in trouble a little bit. So review your policies, create your policies. If you need help with that, reach out to your Eide Bailly auditor. That's something we've been very familiar with over the last couple of years. Reporting. What I see most here, and there's a couple on this slide, but what I generally see is just inaccurate reports, and they're not tying to anything. They're not supported by any reconciling items. And I think what it comes down to is there's just, in general, been a lack of review on reports. Either one person's been preparing it or the person who signs it hasn't actually been reviewing it. And those are, kind of the leading causes for that. Take a look at your reports and make sure they make sense. Like, do a once over, do these make sense? Do they reconcile to the underlying information? I think, the effective review is key for reporting. Okay, and there are a couple of questions that we'll take in just the last couple of minutes. If you have others, please chat them. But if a federal program is over $750,000 in the current year, but was audited 2 years ago, so that it has 1 more year left before it reaches the audited every 3-year cycle? Is it required to be selected as a major program in the current year? Or can we test a B program instead, as long as we have the 20% coverage for a low risk auditee? Okay, so if it's over 750 and it is a type A program, if it didn't have any findings in the most recent audit period and it was audited within the last 2 years and it meets the other 2 other criteria, meaning it wasn't deemed high risk and that it wasn't had significant changes in personnel or program, then that would be a low risk A. And if it's a low risk A, then you replace low risk A's with high risk B's up to the 1/4 calculation. So yes, it can be replaced with a B, and it just depends on whether it's a low risk A or not. If an organization has a GPO with signed contracts and existing contracts that were entered into prior, can that qualify as a competitive purchase? So good news is, on a couple of these grants that allow for recoupment of past expenses, then those may not have needed to follow the procurement guidelines. Very specific rules though. If your grant is on future and forward-looking expenses, chances are, unless explicitly stated that they don't need competitive purchases, you would need to ensure that they were competitively purchased. Now, if you use some sort of purchasing alliance, purchasing alliances by their nature are considered competitive purchases. So, you know, there is some wiggle room there. That's kind of a case-by-case basis, and we'd have to look at individual costs. Do I have an estimate of the amount of ARPA funding for 2023? So ARPA has been distributed, at least first tranche, mostly. I think second tranche has come out. Maybe not. It's up for debate in the feds. It might get reappropriated, but I do not have any estimate for that amount. And especially if you're a nonprofit, you're receiving subgrants from the state. That's up to the state spending plan. Are there specific parties that need to review and sign off on all reimbursements? No, nobody specific is required, but it should be somebody that makes sense. It should be some sort of supervisor or somebody with knowledge of the grant requirements and or the accounting system. It should be somebody logical, right, to sign off on reimbursements. It shouldn't be, you know, somebody that has no idea about grant requirements signing off on it. So it should be logical. Okay, we're getting quite a few more questions, and we're out of time. So I will take these questions offline and respond via email to those of you who are leaving them. But with that, I want to thank everyone. If you need to contact me, if I didn't cover something, there's my number, my email. Please feel free to reach out. And I appreciate your participation and time and attention today.